Carbohydrates provide energy as well as many essential vitamins and minerals. However, carbohydrates that are not needed immediately for energy are stored and can eventually convert into fat. In this module, we discuss your daily carbohydrate requirements and take a closer look at some of the challenges that carbohydrates, like refined sugars, may cause after weight loss surgery.
Carbohydrates can be divided into two main categories. You find first your simple carbohydrates, which are things like sugar, and also fructose, which is a natural occurring sugar in fruit, and also lactose, which is a naturally occurring sugar in milk. The other category of your carbohydrates are your complex carbohydrates, and these are the ones that we want you to focus on after surgery. Your whole grain breads and cereals, your beans, and also your starchy vegetables like corn and peas. Initially, your carbohydrate goal is to get 50 grams in or less. You want to, again, focus on your fruits and vegetables and your whole grains, and make sure that as you introduce fiber back in, that you do it slowly because you need to allow your stomach time to heal. You can introduce raw fruits at 3 weeks and raw vegetables at 4 weeks.
Lactose intolerance is one of the problems that some of our patients might face after a weight loss surgery. I think that gastric bypass patients are probably a little bit more prone to it. We see up to 20% of our patients who have root-wide gastric bypass having some intolerance to lactose, which is basically the sugar that's in milk and milk products. The symptoms that they have usually are going to be after eating something or drinking milk or eating something that is made with a milk product. They might have gas, maybe a little bit of bloating, and sometimes loose stools. The important thing in terms of identifying whether or not you have lactose intolerance would be paying some attention to when you might have those symptoms, and sometimes using a journal or just jogging your memory that I'm having these symptoms and thinking about what did I eat.
As a duodenal switch patient, there are certain sugars you need to avoid after surgery because they will lead to extreme gas distension and diarrhea. This discomfort can last many hours, so please read your labels closely and avoid any words that have sugar in them, such as corn syrup, molasses. Even if it says pure raw cane sugar, your body still sees it as sugar. Sugar alcohol words such as dextrose or mannitol, these words your body cannot differentiate between a sugar alcohol and a real sugar word, and you will have the exact same GI distress if you eat any products that have itol or os words in them. So I encourage you, please read your labels very carefully before you purchase products.
Your daily goal for carbohydrates is less than 50 grams. Focus on complex carbohydrates such as whole grains and starchy vegetables. Introduce raw fruit and raw vegetables after 4 weeks. Journal your food intake to help you identify the foods that may be causing you problems. Highly concentrated or refined sugars have little nutritional value and are added to many processed foods. Develop the habit of reading food labels. Avoid foods with added sugar such as ice cream, pastries, cakes, energy drinks, and sweet teas. Remember to complete the assessment form and write down any questions you may have. When you are ready to continue, use the menu on the left to select the next module.